Okay, members, we will get back to work here, and so our next bill is going to be House File 607, and I will move that House File 607 be re-referred to the Committee on Health and Human Services Finance. And we have Representative Tice and Representative Pugh. If you guys could present your bill, and we will go from there. Representative Pugh.
Thank you, Madam Chair. Yes, Cindy Pugh, second-term state representative representing House District 33B, serving Chanhassen and the area, greater area around Lake Minnetonka. Madam Chair and members of the committee, thank you for hearing my simple and straightforward bill, House File 787, which would bring an end to taxpayer-funded abortion.
And excuse me, I'm sorry, Representative Pugh, I'll just clarify too for members in audience. Representative Tice and Representative Pugh have identical bills, and so just for members, we're working off of House File 606, I'm sorry, 607, excuse me, and that is also the bill that Representative Pugh is speaking to, just so there's no confusion. Representative Pugh.
Thank you, Madam Chair. I appreciate the many co-authors who have signed on to my bill, including Representatives Dean, Shoemaker, Baker, and Chair Mack, who all serve on this committee. The debate goes on about abortion, whether it's right or wrong, whether it's ethical or unethical, and more. My bill does not address this very controversial issue. What my bill does do is speak to whether taxpayers should be required to subsidize the practice. It appears to me, based on my having reviewed the statistics, that abortion has become a bit of an industry in Minnesota, and taxpayers are footing 1/3 of the bill. As a second-term state legislator representing one of the highest tax districts in the state, I've become increasingly sensitive to the many ways my constituents have been burdened by taxation, and sadly, the impact that high taxes have had and have inflicted upon the hardworking families throughout my district. Since 2012, I have been engaged with constituents throughout my district, and when this subject matter has come up, and it has frequently come up, I found the common ground, a point on which we can all agree, is that taxpayers should not be expected to pay for abortions. I believe my bill is reflective of the will of the people in my district and would be in a majority of House districts on a bipartisan basis throughout the state of Minnesota. And one final point, just as our legislature has done twice in my brief tenure, specifically regarding taxes, we've worked diligently to achieve federal conformity. My bill would accomplish this regarding abortions. I ask for the committee's support in support of this common sense bill. Our state's hardworking, tax-paying citizens deserve our support. Thank you so much, Madam Chair and members of the committee.
Thank you, Representative Pugh. Representative Tice, anything you want to add?
Yes. Thank you, Madam Chair and committee members. I am honored to be here today to bring forward House File 607. I door-knocked a lot of homes in the last several years, and the one question I got most frequently was regarding my pro-life stance, which I was very pleased to say I am pro-life. I believe it is my duty to represent my constituency in challenging and changing our current law. I believe that one place to start is with this bill. My folks are not happy about spending their hard-earned money on elective procedures because of the Minnesota court's 1995 Doe versus Gomez ruling. Taxpayer-funded abortions have swelled to 34.8% of all abortions performed in the state, according to the Minnesota Department of Health. It is unfortunate that taxpayer-funded abortions have been on the rise in Minnesota in the recent years. As an advocate for my constituents, it is my duty to make some changes. I appreciate this opportunity.
Thank you, Representative Tice. Ms. Rao.
Thank you, Madam Chair and members of the committee. Once again, I hope you aren't too tired of seeing me. I do urge you to pass House File 607. House File 607 would conform Minnesota's policy on abortion with the federal government by reinstating a ban on most taxpayer-funded abortions. In 1978, Minnesota passed a law that prohibited taxpayer-funded abortions, except in cases of rape, incest, and to save the life of the mother, just like the federal government's Hyde Amendment. However, a lower court ruling in June of 1994 struck down that ban. In the Minnesota Supreme Court's 1995 Doe versus Gomez decision established a right to abortion in the Minnesota Constitution, as Roe versus Wade did on the federal level. However, the Gomez decision goes even further by requiring that Minnesota taxpayers be forced to pay for abortions, one of the nation's most extreme policies regarding abortion. As a result, today, a third of all abortions performed in Minnesota are paid for with tax dollars. In most recent years, this amounts to more than $1 million each year. From the time of the court decisions until the end of 2012, taxpayers spent well over $20 million on more than 65,000 abortions. State tax money in Minnesota is used for a lot of good things. It funds our schools, our parks, and our nursing homes. It builds our roads and bridges and helps the underprivileged. But in recent years, our taxpayer dollars have also been diverted for the purpose of killing unborn children. So while the vast majority of state money is arguably used to build a better life for Minnesotans, some tax dollars help to end the lives of Minnesotans. A Marist poll conducted in January of this year found that 68% of Americans oppose taxpayer-funded abortions. This includes 69% of women and 49% of those who self-identify as being pro-choice, all in opposition to taxpayer-funded abortions. This polling is very consistent with what we typically see. Some may argue that it is discriminatory to not provide low-income women with a taxpayer-funded abortion. However, federal courts have disagreed with this notion. In fact, for decades, the federal government has forbidden most taxpayer-funded abortions, just as we seek to do here today. This is not an issue of whether abortion should be legal or illegal, as this bill does not seek to outlaw abortion. It does, however, return the issue of whether or not the taxpayers of this state should be forced to fund a practice which the majority oppose to the policymakers of the state where the decision is rightly decided. A ban on taxpayer funding of abortion is a reasonable measure which should be supported by pro-life and pro-choice advocates alike. Unless we wish to force citizens to fund an act which they do not support and which doesn't further the public good, and do it at a rate of roughly 10 times every day, including weekends, we should all be supporting this common sense legislation that protects and respects our fellow Minnesota citizens. I urge you once again to support House File 607 and would be happy to answer any questions. Thank you.
Thank you, Ms. Rao. We will go to further testifiers at this point. We first have Andrea Ledger. Welcome again to the committee and proceed with your testimony.
Madam Chair, members of the committee, nice to be here again. We have the most popular name in the room tonight. Again, I'm Andrea Ledger, Executive Director of NARAL Pro-Choice Minnesota, and I'm here to speak in opposition to House Files 607 and 787. First, I believe that we can all agree that we want women to be healthy and safe, even if we disagree about abortion. A woman's health insurance should enable her to take care of her health and well-being. When a woman needs to end her pregnancy, by providing health care coverage for abortion, we're helping to ensure that she will be able to see a licensed, quality health provider and get the care that she needs. In the real world, restrictions on abortion access don't eliminate abortion, but they can push women to make the decision later in pregnancy or push abortion out of reach altogether. Low-income women often have difficulty raising the money to pay for abortion care, and research indicates that economic barriers often cause them to obtain abortion care 2 to 3 weeks later in pregnancy than wealthier women. This is especially problematic because the cost of abortion increases the longer the pregnancy continues. This bill would also create profound hardships for women and families across the state, particularly for those who already face significant barriers to receiving high-quality health care, such as low-income women, young women, and women of color. When a woman is living paycheck to paycheck, denying coverage for an abortion can push her deeper into poverty. Indeed, studies show that a woman who seeks an abortion but is denied is 3 times more likely to fall into poverty than one who is able to get an abortion. Finally, when it comes to the most important decisions in life, such as whether to become a parent, it is vital that a woman be able to consider all her options, including an abortion, no matter what her income or her form of insurance. A woman facing an unintended pregnancy should not have to make her health care decisions based on whether she has enough money. It should be based on what is best for her and best for her family. If abortion coverage is available to some, it should be available to all. Simply put, we shouldn't treat some women's health needs differently than others just because of the type of insurance they have. Singling out abortion services for exclusion from state health care plans that cover pregnancy-related care jeopardizes women's health and discriminates against low-income women. I urge you to vote against these bills, and I'd be happy to answer any questions.
Thank you for being here again.
Thank you.
Our next testifier is Karen Law. Welcome to the committee. If you could introduce yourself and proceed with your testimony.
Thank you, Madam Chair and members of the committee. My name is Karen Law, and I'm the Executive Director of Pro-Choice Resources, a grassroots advocacy and healthcare resource. For over 48 years, Pro-Choice Resources has served women and their families. Clergy and doctors founded our organization as they believed all women should be treated with respect. Our mission is to ensure that all people in communities have the power and resources to make the sexual and reproductive health decisions with self-determination and dignity. We believe that access to all reproductive health care is a basic human right. I'm here today to speak in opposition to House Files 607 and 787. We know that the majority of Minnesotans want our representatives to treat all people with respect and believe that a woman, not politicians, should make the informed decisions when it comes to her own pregnancy. Yet House File 607 and 787 purposely interferes with the woman's personal decision-making. For many, coverage for abortion care means the difference between getting the health care they need and being denied that care. We should not create additional burdens and restrictions that deny health care coverage for someone who is eligible and qualified for Medicaid just to make it impossible for her to have an abortion. I do not understand why we push for these bans when we know these bans will harm Minnesota's most vulnerable women and families. It seems unjust, unfair, and discriminatory. There's a misconception that the bills that have been put forth are to protect women and are in the best interest of our community. Sadly, this couldn't be further from the truth. These bills are thinly veiled pieces of legislation designed to create additional barriers to abortion and push this service out of reach for poor women. At Pro-Choice Resources, we know that communities and families thrive when women are able to make the decisions that are best for themselves and their family. Every day we hear from women who are struggling to make ends meet and who are often overlooked or misrepresented when it comes to the politics of abortion. These women are seeking resources for basic health care. Pregnancy happens in the broader context of our lives, and only the woman knows the full story and circumstances around her decision. For example, a woman that we've served, her name is Becky. Becky is 35 years old and the mother of 2 children. She has a job where she works 12-hour shifts, but she's never guaranteed a set number of hours per week. It shouldn't matter whether Becky has private or government-funded health insurance. She should have coverage for a full range of pregnancy-related health care, including abortion if she needs it. It's important to provide insurance coverage to ensure that all women will be able to see a licensed, quality health care provider and receive safe care if we truly want to help and protect the women in Minnesota. It makes sense to me that health programs for women with low incomes cover birth control and abortion, not just childbirth, because when people can plan when and if to have children, it's good for them and our society as a whole. I urge this committee to oppose House File 607 and House File 787. Thank you for your time, and I'm available for questions.
Thank you for being here in the committee. Our next testifier is Reverend Abigail Henderson. Welcome to the committee. If you could introduce yourself and proceed with your testimony.
Thank you. Madam Chairwoman and members of the committee, my name is Reverend Abigail Henderson. I am the Associate Minister of First United Church of Christ in Northfield. I am also on the board of the Minnesota chapter of the Religious Coalition for Reproductive Choice, and I would like to speak in opposition of HF 607. I hope that my testimony will remind you that the religious voice is not united against abortion. My words reflect the values of a wide range of clergy and people of faith across Minnesota, and my goal in speaking is not to persuade those who don't agree with me, but rather to lift up a perspective I hope will not be discounted as you consider this bill. Here is where my Christian faith has led me on the subject of abortion. I pray to a loving, forgiving God of grace. I pray to a God who stands with people when they are suffering and when they are faced with difficult decisions, and this includes women who make the decision to end a pregnancy. I pray to a God who understands that human existence is complicated and difficult, and who yearns for us to treat one another with mercy and compassion. I pray to a God who seeks justice, and from my perspective, this means that God calls us to create a world where all people can access legal medical services regardless of race or economic status. Finally, and perhaps most importantly, I pray to a God who represents my best understanding of what is sacred and good. And I know that many in this room do not share my religious values, especially regarding abortion. I don't want or need to change anyone's personal attitude toward abortion. What I hope and pray for is the day when each and every woman is empowered to make her own reproductive decisions in light of her values and conscience and her own relationship with God. I have arrived at my position on abortion through prayer, discernment, and conversation with people whom I trust. And so I trust other women to do the same when they consider when, how, and if to bear children. Therefore, I cannot support HF 607 because it prohibits state-sponsored health plans from providing abortion coverage. It seems to me that such legislation reflects the viewpoint of a particular religious-based perspective on abortion. Behind this bill, I see a violation of my deeply held religious beliefs, as well as the religious beliefs of countless women across Minnesota. I believe it is not the government's role to make such important, intimate decisions on behalf of women who rely on state-sponsored health insurance. Privileged women can and do exercise their constitutional right to abortion in Minnesota, and I believe that low-income women deserve the same level of dignity and self-determination. So I urge the committee to protect religious freedom and respect all women's dignity as you consider HF 607. Thank you very much for this opportunity to speak to you.
Thank you so much for taking the time to be here. Our final testifier is Raleigh Levine. Welcome to the committee. If you could introduce yourself for the record and proceed with your testimony.
Thank you, Madam Chair, members of the committee. My name is Raleigh Levine. I'm a professor of law at the William Mitchell College of Law, and one of my areas of expertise is constitutional law. My statement will focus on why House Files 607 and 787, if they were to become law, would violate the Minnesota Constitution under the precedent set by the Minnesota Supreme Court in 1995 in Minnesota, in Doe versus Gomez. In that case, the Minnesota Supreme Court held that a law that allows the use of public funds for childbirth-related medical services, but not abortion-related medical services, violates a woman's fundamental right of privacy under the Minnesota Constitution. Even were the U.S. Supreme Court to overrule its decision that the federal Constitution no longer protects the right to abort pre-viability, the Minnesota Supreme Court's independent decision about what the Minnesota Constitution protects would not change. As the Gomez Court stressed, the federal Constitution is a floor, not a ceiling, and states are free to determine that their constitutions are more protective of civil liberties than is the U.S. Constitution. Like Minnesota, several states have decided that funding childbirth-related but not abortion-related medical services violates a state constitutional privacy right. In so holding, our state Supreme Court explained that restricting government funding for abortions often means that poverty-stricken women will not choose childbirth over abortion, which is apparently one of the goals of the law, but rather will simply delay abortion while they seek alternate funding. But delaying an abortion increases the health risks that women face in connection with the procedure, which subverts the very purpose of state-funded health services, which is to alleviate the hardships faced by those who otherwise cannot afford medical treatment. Moreover, those low-income women who do choose to carry their pregnancies to term simply because they have no other feasible financial option have had the exercise of their fundamental right to choose discouraged just as effectively as if their right to abort had been denied outright. The funding denial thus constitutes an infringement on the fundamental right to privacy. Because the discriminatory healthcare funding at issue in House File 607 and 787 infringes on the fundamental right to privacy, the state may enact such discriminatory measures only when it can demonstrate that it has a compelling interest, not just a legitimate interest in doing so. It could not demonstrate such an interest in Gomez, and it cannot do so now. Neither an interest in protecting potential human life nor an interest in encouraging and supporting childbirth is compelling unless and until the fetus is viable, capable of surviving outside the mother's womb. And even then, a mother need not sacrifice her own life for her potential child's. To find that HF 607 and 787 are constitutional, then, the Minnesota Supreme Court would have to overrule Gomez, a case that has been the law of this land for 20 years, violating the principle of adhering to precedent, stare decisis. Even though the state Supreme Court's composition has changed since 1995, and even conceding that the Gomez decision is, of course, politically divisive, public disapproval of a logical, well-reasoned decision is not considered a sufficiently compelling reason to overrule it and would violate the stare decisis principle. Thus, I urge you to recognize that were HF 607 and 787 to be enacted as law, the Minnesota Supreme Court would and should strike down that law under our state constitution. Madam Chair, members of the committee, again, I thank you for allowing me to testify today, and I will remain available for questions.
Thank you for taking the time to be here. We appreciate it. Is there anyone else in the audience who wants to testify to this bill? You can come forward. Thank you. Welcome to the committee. And if you could keep your comments to about 2 minutes, as we've asked other testifiers to do, we appreciate it. Welcome.
Yes.
Introduce yourself, and you can proceed.
Of course. My name is Brody Hagemeyer. I'm from St. Cloud, Minnesota. I'm here representing Students for Life of America, as well as my university, SCSU for Life, our pro-life group at St. Cloud State University. The comments that I have regarding taxpayer funding abortion are these. Taxpayer funding of abortion is an extreme position that many Americans overwhelmingly do not support. A CNN poll showed that 56% of Americans are not in favor of taxpayer funding of abortion. Other polls report similar numbers. To force taxpayers to pay for abortion is an extreme view of the abortion industry. There is no reason taxpayers should pay for abortions when the nation's largest abortion provider, Planned Parenthood, brings in over $1 billion on an annual basis, according to their most recent annual report from 2013-2014. Banning taxpayer funding of abortion is a reasonable request which both sides can agree upon, and as a pro-life Democrat myself, I agree that taxpayer funding of abortion should cease in this state and in this country immediately. Thank you.
Thank you so much for being here. Appreciate it. And one final testifier. Welcome to the committee. Please introduce yourself and proceed with your testimony.
Absolutely. Thank you, Madam Chair and members of the committee. My name is Angela Erickson, and I am the Northern Regional Coordinator for Students for Life of America. We work with over 830 pro-life groups across this country, so I'm here to represent all of those pro-life individuals across our nation. I'll make this short and sweet. Abortion is the taking of life, and no one should be forced to pay for it against their will. As a taxpayer in Minnesota, I disagree with my funding and my taxes being used to end the life of another human being. Science has proven that life begins at conception. Ultrasounds easily show the preborn baby is alive. And abortion takes a life, and therefore, like I said, no one should be forced to pay for it against their will. While the U.S. Supreme Court gave women the right to choose to have an abortion at any time in their pregnancy, for whatever reason, that doesn't mean that taxpayers should be required to fund that choice. Lastly, abortion is not health care, and taxpayer dollars should not be forced to fund it. Contrary to the notion of good medicine and saving lives, abortion actually does neither. Taxpayer dollars should never be used to fund the taking of an innocent life under the guise of health care. Thank you.
Thank you so much for taking the time to be here. Members, any questions? Representative Liebling.
Well, Madam Chair, I just want to correct one thing that I've heard a couple of times in this hearing, and people have characterized Roe v. Wade as saying that abortion can be chosen at any time for any reason, and I don't think that is exactly true. I think that Roe v. Wade set up a system of restriction depending on how far along the pregnancy is, and I just want to correct that because I think it's really important for people to understand that, in fact, there is no abortion on demand at any time for any reason. That simply is not true.
Representative Fisher.
Thank you, Madam Chair. We've heard a lot today about taxpayer dollars and how we should be taking care of taxpayer dollars. And I guess the concerns that I have is that sometimes we get so concerned with taxpayer dollars that we forget the damages that occur when we don't have proper dollars floating to support services. And where I get frustrated by it sometimes is where people are saying, you know what, we don't want to fund this process or that process, and at some point it starts raising the questions of, do we start saying, should we start not funding vaccines because some people are concerned about vaccines? But I think the real problem that I have is that I work at a homeless youth shelter, and I want to point out some very hard facts out there. Is that tonight, last night, very cold nights, there were over 2,000 female youth who are on the streets. The problem is that a lot of those youth sometimes are faced with tough choices if they're going to stay warm and survive the night, or risk being outside the entire night or in very unsafe situations. And sometimes they are put into situations where they have no choice. These youth are covered by our state programs, these women. And sometimes they are put in situations where they end up being pregnant afterwards and needing to deal with it. Or, as I have seen, youth who have been abused, coming from very dysfunctional homes where rape or incest has occurred. And when the youth have tried to deal with it, they've been called names, thrown out of the houses and kicked out, saying that they had actually seduced the male in the house and called sluts in the process. Unfortunately, they are pregnant in the process, and now they're trying to figure out how to deal with things because they know if they're pregnant, they're never going to be able to return home at all because of the relationship that was going on. These are real hard facts that we see on a daily basis. Sometimes these youth are faced with no other choice but to have to end a pregnancy, one that they did not choose to have. And unfortunately, they are under the state health care programs. And by saying that we are not going to allow them to be able to make a choice, a free choice that they have, they are stuck with a very unmanageable situation and continues the cycle of poverty. Maybe if we had focused more money in the past on trying to solve some society's problems, we would not be facing as many of these decisions that we are now. But this is the reality that we face. And I feel very strongly, and for the youth out there that are not able to be here tonight because they're trying to figure out how to live and survive, they would be offended by not being able to have, being through a terrible situation, not be able to have a choice and being able to have it taken care of.
Representative Moran.
Thank you, Madam Chair. So we've gone through a few bills that really has attacked the concept of abortion, you know, and I'm really confused whether or not these meetings were meant to, you know, to represent the voice of the woman, whether or not there's a clean, safe facility, you know, whether that really matter or not, you know, whether or not the care of a woman really matters in this or not. I'm really confused, you know, or, you know, I'm hearing a lot of conflicting statements from our testifiers as to why, you know, this issue is so important to her. But I have a question here that I would like to ask of anyone out there. And the question would be, because my hope is that we do care about life in all its stages. So my question is, can you, through your bills and through your ideology, ensure the safety of women who cannot access an abortion because of the cost?
Representative Tice, excuse me.
Thank you, Madam Chair. I actually have been part of an organization for many years, and it's called Birthline. And in 1977, I was a client of Birthright, which is now Birthline. And what Birthline does is it provides counseling and help to folks who have a crisis pregnancy. And there are other facilities in St. Cloud as well, the Pregnancy Resource Center, who Birthline works with, because even though they're both crisis centers, they do different things. And so what I can, and I'll speak about Birthline because I know that better. So what they do is they do provide counseling, and they provide support. They provide people who will be in their corner and help them to find out the options that are available. Birthline's mission is to love everyone and to love them where they're at. And if a woman does come in and she decides her only option is abortion, they will do post-abortion counseling, because they believe that that woman is that special to them. And even though Birthline is a pro-life group, their mission is to take care of the women and make sure that they're healthy and that they make good choices. So when I come before you with a bill like this, and it's because my constituents are telling me they want something like this. And I do believe that as legislators, we come here with ideas we get from our taxpayers, from our constituents, and it is our job to come before this body and say, we don't believe this is right. I do know from experience that lives can be changed. And not only is it just a solution, but Birthline will work with people to make sure they get back on their feet, to feel sure that they can find some other options. And probably, I know some of the counseling includes going to school, to looking at, bettering themselves and either getting their GED or going on to school. So there are programs out there. It isn't just, I'm not just saying that, it's bad. Being part of Birthline was very, very rewarding in that we really did work with people. And fathers were invited to come with as well. So it was something that I just don't think enough folks know about this. And these programs are out there. So when I come before you with this, it's not just saying that this is what we need to do. I do know that there's options. And I think we need to do a better job of saying what those options are. And that is what really saddens me the most, that a woman feels like her only option is abortion. And I don't believe that's true. I've seen it. I've seen the folks who have gone through the program and made whatever decision they decided to do, and I've seen them grow and to be very grateful and thankful. So I just wish that there was a way we could do a better job of doing that and not just saying that their only choice is abortion.
Okay, Madam Chair.
Representative Moran.
So I would say here in the 21st century, I think there are many women who know that there's options, who know there's choices, who know and believe that abortion is not the only option that they have. That even when they go into a Planned Parenthood clinic, they are advised, they are given support. They're not just led to the decision of an abortion. And maybe that's a misconception that many have, that is the process, that is their goal, and that is not the goal. The goal is not that process. And so, and again, before Roe versus Wade, we know what that looked like. We knew when women decided to have an abortion and they was determined to have an abortion, what those back alley abortions looked like. It looked like the stories that we was hearing earlier about unlicensed clinics, right? Trying to give us this visual of this dark, dirty, unclean place. Well, we're not at that place. We're not at that place today. And so my question still stands. How can you ensure the safety of a woman who makes the decision that she wants an abortion? Where would we find ourselves today if we decide that a woman who cannot afford an abortion, as it was 40 years ago, how can we ensure her safety, her well-being?
Representative Tice.
Thank you, Madam Chair. I really don't know that anybody can guarantee anything like that. And I would not want to take on, you can't do that. You can't guarantee anything. What I can guarantee is there's folks out there that are willing to help. And I know that's not the answer you want. But I won't guarantee anything. Just like I can't guarantee that a woman who maybe makes an adoption plan is not going to have some real problems with it. There are no guarantees with any of this. But what I do know is there's a lot of people available to help. And I also know that when I look at the folks in my district, they are not happy about what's currently happening. They would like to match what our federal level is doing, and I don't think that's out of line.
Yeah, Madam Chair.
Representative Moran.
I just want to read and maybe inform and maybe do a little education with you that what happens when a person is considering an abortion. So abortion is one aspect of health care for women. Today, half of all pregnancy in the U.S. each year are unintended, and 4 of 10 of these are ended by safe and legal abortions. Prior to an abortion, a woman who is thinking about ending her pregnancy receives accurate and unbiased information from a healthcare professional about her options, parenting, adoption, and abortion. The patient completes a medical history and has blood testing and an ultrasound when needed to date the pregnancy. She learns how the process works, the range of normal symptoms to expect, and the warning signs to look for. Just like any outpatient medical facility, health centers that provide abortions have staffing, equipment, and referral arrangements in place to handle emergencies in the unlikely event of a complication. So women who choose abortion can reach a medical professional 24 hours a day, 7 days a week to answer questions. In the extreme rare occasion of a complication that requires a hospital visit, emergency room medical professionals are trained to provide the care and intervention that a woman might need. So I say currently we can guarantee some safety there. We can guarantee that if a woman chooses to have an abortion, that she will be safe, she will be cared for, and she will have the information and the support that she needs and options.
Members, any other questions? Representative Mullery?
Thank you, Madam Chair. I just have 5 sentences, so pretty quick wrap. As was explained tremendously by the law professor, it's clearly unconstitutional under the present Minnesota court decisions, but there's a couple other problems. There's a huge problem, and when it says state-sponsored health programs, that could be MNsure, it could be MA, it could be MNCare, it could be state employee insurance, could be local government employee insurance, and private plans regulated by the state. So that's just an open thing that's not defined at all, so it's pretty meaningless. But really far more important to me than the unconstitutionality is the fact that as a family law attorney, a lot of clients really actually discussed their lives with me. And I had many clients over the years who had backroom abortions from non-professionals or did it themselves, and they had lasting problems years later. And it really bothered them both physically and mentally. And I just because a woman has a low-paying job shouldn't mean she's subjected to dangerous procedures, especially for unintended pregnancies. And I just don't understand why you're going after low-income people.
Thank you, Representative Mullery. And we do have a brief question from Representative Quam.
Thank you, Madam Chair. And I had a question for clarification from the legal testifier. Why is there the ambiguity that there are multiple cases and settled court cases and people that have been found guilty and served time, been fined, etc., where the definition was that they took the life of an unborn infant? They didn't do it in the procedures in abortion. They did it with a vehicle, a drunk driver. They did it as a assault with either a foot, a fist, a knife, or other instrument. And the courts, the state, does not hesitate to say that is the taking of a human life. And therefore, there is ambiguity. And it's the only people they're allowed to take the same definition of a human life are people performing abortions. And so it's a bit of a rhetorical question because we all know the answer that yes, in one hand, the ending of that life is a crime, a serious crime. On the other hand, it's not. And you can dance all you want and say it's settled, but there's ambiguity there, and we need to realize it.
Representative Liebling?
Thank you, Madam Chair. Well, we keep hearing today that these bills are not about restricting abortion, they're not about ending abortion, but clearly they are. Those of you who are newer here, these kinds of bills come up year after year after year, and it's always the same thing, and sometimes they don't change at all. And this very bill has been vetoed, I believe, last year, and so here it is again. I just really want to respond to this issue about people not wanting to pay for abortions. In the society that we live in the way that we do our government, citizens don't get to pick and choose everything they want to pay for and don't want to pay for. It's just a fact of life. I think many of us would like not to pay for drone strikes to go and kill people overseas, and yet our tax dollars do that, and we don't get to opt out of some particular action by our government that we don't want to, that we don't agree with. There are many things that, even health procedures that certain taxpayers might not want to pay for. Do they want to pay for vasectomies? Do they want to pay for poor women's births? I would guess there are probably many constituents who would say, if women get pregnant and they can't afford the baby, why should we pay for that birth? Why should we pay for that delivery? And in fact, that's a much more expensive cost. Certainly, I've heard that in relation to our MFIP program. Some taxpayers don't want to pay for poor women who have children who can't support themselves. Well, we don't make those decisions as individuals. We pay our taxes. We elect our representatives. I understand, Representative Tice, you're doing what you think you're and Representative Pugh, you're doing what you think that you're being asked to do. When I knock on doors, I have very, very few people bring this up as an issue. And I guess that just reflects the kind of districts we're from. But the Supreme Court, our Minnesota Supreme Court, has spoken on this. And at least here in Minnesota, being poor does not mean that you don't get to make the same reproductive choices that you would make if you had money. And I think Minnesotans, if they really think about it, I think most Minnesotans would agree with that we politicians should not be making choices for women about their most intimate issues, that women are capable of making those choices themselves, and they should not be prevented from that and be sent out to get a back alley abortion and put their life and their health at risk because they happen to be poor. So thank you, Madam Chair.
Thank you, Representative Liebling. Representative Mullery.
Thank you, Madam Chair. Just request roll call.
Okay, Representative Mullery requests a roll call. There will be a roll call. Members, I don't see anyone else with questions or comments. I just had a brief comment, and then we'll let the authors of the bill have a final word, and we will go to the roll call vote. Members and people of the audience, thank you so much for being here today. We always tend to have these conversations sometime during a biennium, and they're not easy conversations to have, and some would disagree with bringing them forward at all, while others, this is really fundamental to why they come to the legislature. And I just want to say to those who feel like this might be an attack on women or on women's rights, that at least speaking for myself, and I think other people around this table, there's nothing that could be farther from the truth. The fact of the matter is that this issue is about a life that has no say, and the fact that many of us around this table can't agree on when a life is a life. And that is the crux of this, many of these issues around the contention around this issue. And that's where the rub is, that's where the challenge is. And sometimes it's misconstrued as going after women or after who caring about women and their rights and their privacy and things of that nature. But The other half of that argument is there's a life involved who has no say. And there are people that think that it's important to be a voice for those. And unintended pregnancies are certainly not something that we wish upon anyone, and need to do things to put supports in place for those women in that situation. But I just want to speak on behalf of, as the chair of this committee, why these bills came forward. And it is for the unborn that many of us are passionate about protecting, and certainly that's something we don't all agree on, is, again, what a life is. But from my perspective, it's an important piece of what we're here to discuss and decide as legislators and as public policy. And so thank you for taking the time. It's not an easy committee. It never is. But thank you to the authors for bringing these bills forward, and to the thoughtful comments and questions from the members of the committee. So with that, Representative Pugh and Representative Tice, if you could just briefly close out on your bill, and we'll go to a vote.
Well, thank you, Madam Chair and members of the committee. I really appreciate your consideration of this bill. I have voted in support of pro-life bills before, but I've never spoken up about it. But I felt it incumbent upon myself to do so. Again, I've spoken with my constituency repeatedly, and this issue has come up, and when it has, this is the common ground. This is a very contentious issue, but this is the common ground that my constituency has spoken to, that it's just not right to make them pay for an abortion for whatever reason. And Representative Liebling, I appreciate your comments and acknowledging that we're bringing these bills because we are responding, to our constituency, just as each and every one of us do with any bills that we bring before the legislature. And to your point, when you commented that, we pay taxes and, we can't opt out. Well, the thought immediately crossed my mind that my constituency is in the process, and has been over the course of the last 2 years, opting out of Minnesota, of staying in Minnesota. I have a running total of 13 states that my constituents have relocated to, based on the taxes and just the onerous, regulations, small business owners. I could go on, and that'll be another conversation. So I'm really ultra sensitive, maybe more so than some, but about the taxation, and this is an issue that I've heard about, and I would just comment that, to Representative Moran's really, sensitive and sincere, questioning, and the comments that you made. You started out with the comment about, abortion being health care, and I've specifically heard repeatedly from my constituency, and I agree with them on this point, that abortion isn't health care. So there's a difference of opinion on, a lot of aspects of this really sensitive subject matter. So I just want to say that, this is obviously a matter that we're, going to, have to agree to disagree and continue the conversation. But it's really important to me, and I appreciate your consideration of supporting this bill and moving this along to the next committee. Thank you.
Representative Tice.
Madam Chair, thank you. I really do appreciate the opportunity to be here today. This is important to my district, and it always has been, and it is important to me as well. If anything comes out of this, I hope more people realize that there are some organizations out there to help and to reach out for that help. I would rather see that happen than changing law. But as far as the constitutionality of it, I believe that we all have an obligation to do what our district believes is right. And if it is to challenge current law, so be it. I'm willing to take that chance. And really what we're asking for is to do what our federal government is doing as well. So with that, thank you very much, and I would certainly appreciate your support.
Thank you, Representative Tice. Okay, members, with that, there is a roll call on the bill, and the clerk will take the roll.
Chair Mack.
Yes.
Vice Chair Peterson.
Yes.
DFL Lead Mullery.
No.
Albright.
Yes.
Allen. Thacker,
Yes.
Baker,
Yes.
Dean,
Yes.
Fisher,
No.
Franson,
Yes.
Freiberg,
No.
Kelly,
Yes.
Liebling,
No.
Loeffler, Lomer,
Yes.
Mason,
No.
Moran,
No.
Pearson,
Yes.
Quam, Schumacher,
Yes.
Schultz,
No.
Zerwas,
Members, there being 12 ayes and 8 nays, the motion prevails and the bill is re-referred to the Committee on Health and Human Services Finance. Thank you, Representative Tice and Representative Pugh. Members, that concludes our business for the day. Representative Liebling.
Thank you, Madam Chair. And I just want to just make one further comment because I think it's not fair. You know, I heard the chair characterize why the pro-choice side feels as it does. And I think that there was a misstatement there. And I think we should speak for ourselves about what the difference is in our views. The difference is not when life begins. Now, different people may have different views about when life begins. I think I can speak for the pro-choice side in saying that what we believe is that each individual woman should decide what she believes. It's not when I believe life begins. It's when that woman, who's as much entitled to make that decision as I am, it's what she believes and how she balances those interests. And I think that is the difference. And I just think that needs to be said because, you know, for you it may be when life begins, but there may be members here who believe that it begins when you believe it begins and still feel that another person should be able to make that decision for herself. So thank you for letting me say that.
Sure. Thank you, Representative Liebling. And I think probably a lot of mischaracterizations come from both sides. And just very transparently, I've just had conversations with people that we disagree and have understood that that tends to be one of the common areas of divide. But I appreciate your comments. And with that, members, our next committee hearing is on Friday at 10:30. Members, we are adjourned.